Meeting is being
Hi.
again. I
Good
think
morning, Dr. Bukhari, please. Yeah. Good morning, everyone. So we'll start the session from where we ended. We are very sorry. There's a problem with the technical side of Zoom, and we are trying to resolve it. And we are back in the session. Over to Dr. Raman.
Thank you, Saurabh. So we were talking about the fact that we need the two wheels of the cycle to be equivalent, and that's why we need to give more push to men as well. So basically, let's start from where it all began and how it has evolved to such a pathetic state for men. So initially, we all know it was a patriarchal society. Men have enjoyed the privilege of having the status in the older times, and men's health was actually correlated with the strength of the nation. And sexual health was given an utmost importance. But unfortunately, at that time in the historical roots, women, they were just, their health was just considered an immature version of that of a man. And it was basically a one-sex model, which was a bigger problem with the society. So over a time, the evolution of female medicine happened, and we understood that we need to give more priorities to women's health, and that's how somehow we got lost in helping women. And for that matter, it was a very good thing that happened. But the only thing that happened bad was that men started neglecting their own health, and we also kind of lost the consciousness that men's needs are very different in terms of health. Because men, they typically don't go to a doctor unless the problem has become very severe. They are too self-reliant now in the process of helping women. And the perception of invincibility that comes from our, chasing the Herculean image, where we don't care about ill health, it's not discussed anymore in the groups. It's a very goal-oriented discussion that men have with each other. There's a fear to share amongst men because everything is linked to the livelihood. If tomorrow if you get to know that Dr. Raman is not doing well, the patients may reduce in number. So everything, would reflect professionally on the man, and his innate, need to be able to provide for the family stops the man from actually sharing the problems. And then he resorts to something which is very common, which is substance abuse, which just leads to a downward spiral for the man. So the psychology of man has been very different, and that comes from very obvious from the fact that the first testicular guard in cricket was in 1874, and it took us about 100 years to understand that the helmet is also necessary. So we do understand where the weak point of a man is, and this is a clear understanding of how man interacts with healthcare compared to the women. So women, once they are born, just like the man, they undergo vaccination, they do go to the pediatrician, and it's here because they are not themselves doing it. So if there's there are mothers and fathers who are making men as children go to the healthcare facility. And then women again go to the facilities when they have their first periods, once they have their first intercourse, once they have their menarche, once they have their first childbirth, and then the second childbirth, and then when they have menopause, and when they have chronic illnesses. So these different points of interaction of healthcare, there are numerous points for the women. But men, they would just go initially as a child, and then only if they fall sick or if they have something debilitating that they would, or maybe they end up in a chronic disease, they would want to go back to healthcare. There are no other checkpoints for the man, and that's one of the principal reasons why men are not interacting or are not comfortable in visiting a doctor and sharing with him as a friend the problems that they have. So triggers for interaction for healthcare for women would be a pap smear, the need to look good, just because they want to accompany their best female friend there, or they may be going there for sterilization or childbirth or menarche or menopause or for irregular periods. So men, on the other hand, only go for two reasons. One, if they are not able to work, or if their penis is not able to work. So these are the two important triggers that we have for men. And apart from that, all the other things, all the other mountains that the men are conquering daily, which is fear of failure, or smoking, or porn addiction, or procrastination, or self-doubt, or toxic masculinity, all these things and peer pressures, they are all left behind. So men, they do not, they are not appreciated for the kind of responsibilities that they're carrying, or the work stress they are carrying, or the loneliness they are carrying. Because unless we ask men, and which we rarely do, and then also men rarely tell, and the reason being that who can men talk to? They are not. It's not easy for men to open up because everybody's busy in their own lives. The girlfriend is talking about her own best friend's issues. The juniors want to take advantage if you want to share your weaknesses. Your dad again has not been so supportive, asking you how was your day. So your mom is, again, busy with finding the family's faults, and brother has his own girlfriend to listen to. Just a small understanding of why men do not open up, because they are not taken seriously when they open up. They're just made fun of in front of friends if they talk about serious issues. And also the perception of the society now on men's health is that they would just think that it's a sexual topic that the man is worried about. But what they're not seeing is the stress, the abuse, the anxiety, the burnout, the addictions, the loneliness, the peer pressures, the toxic relationships that a man is going through, the marital conflicts, even very serious conditions like prostate cancers, lifestyle diseases, domestic violence. Men are often, these issues are often brushed aside when we talk about men's health. So typically we did a small study. We didn't even go to the public as best for him as Men's Health Society of India, where we asked men who are the doctors for them. And, while most men knew that the doctors for women are a gynecologist, nobody knew who is a doctor for man. They were just, just scratching their brains when we asked them this question. So basically, many men did have issues, and about 20% of them did go to somebody who was not equipped or medically equipped to handle their conditions. And basically what happens is when men don't know where to go, then they would visit somebody who is not a professional. And when he's not a professional, then they do not get the right treatment that they deserve for this condition. And then because of the poor experience that they get, so for example, I had a problem. I talked to Saurabh as a friend, and then Saurabh just, belittled it, or he just laughed about it. Do you think I would again want to talk about this problem with anybody else as a man? No, I probably wouldn't. And this is the treatment that men get when they share their problems, or they probably get duped. So somebody would say that, okay, you need this kind of a thing. You've done this thing, and that's why this thing happened. Now you need to give me, the millions of rupees or money to kind of solve this. And then they get duped. And that's again a reason why men do not trust the healthcare system anymore. But it is important for them to trust, because men are fathers of the family. They are the supporters of the economy, and there is direct implication of poor health of men, both financially for the family, and then the entire resources of the family are diverted into their care, and that impacts the children, and that leads to underage employments and bigger problems like domestic violence, domestic abuse, child abuse, impact on other members in the form of passive smoking and whatever happens due to substance abuse for men, and even early deaths which lead to unsupported families and disabilities. So with all these things happening, it's very important for us to give a proper space for men's health. And as we know right now, a men's health space is very disorganized. Most of the men's health happens in terms of wellness, or sometimes in the taboo of sexual health, and the medical community is able to serve very little of the current men's health space. But this is absolutely different. Men's health is not sexology. Men's health is not just andrology. It covers all the specific diseases of men, which are just, catering to the problems or organs that only men have, like the prostate, like the urinary system, the genital system, and also the diseases which are more common in men, or maybe more morbid in men. For example, cardiovascular disease, stroke, metabolic syndrome. So these are all things which are more common in men. So where can these fathers get these comprehensive services which are on preventive health, occupational health, and sexual health? That's the problem. And that's why we need to define what men's health is, and also, provide the avenue to men to be able to, go to these men's health services, because we do understand that men are having a poor health status. They have a poor understanding for their health. Their makeup is different. They are not able to utilize these health services. And clearly the efforts which are being done for them are minuscule. They're just, in the form of the talks like these. So we need to define men's health, and then we need to work on men's health, and we need to create a strategy for men's health. So what does this strategy empower us about? So first thing that we have to notice that men do not go to the clinic. So if I am coming to your clinic, then it has taken me a lot of time. I have left something very important for me, according to me, and then I have made up a lot of courage to come and talk about my problem to somebody. So a man will not visit again, and every visit is very important for a man if he comes to the clinic. We know from our research that men worry about their penis most. So if we ask men about what is the most organ important for them, if that got bad, then they would really worry. And then in the options, if they were brain, heart, kidneys, and the penis, then most men would click on the penis. Because this is something that affects their manhood directly. And somehow it's been ingrained that if there's something wrong with it, men are definitely coming forth to talk about it. And even women, for that matter, go because of their periods. So sexual health has been important for both the sexes. It's not something that, is not a taboo for women. So that taboo has been broken by society, as society has evolved for women. But where has it evolved for men? Why are we not open about talking about the sexual problems for men? So we also need to understand in the men's health strategy that we need to offer a holistic therapy. For if a man is coming for a sexual problem, that then we have to understand that a sexual problem is not just a sexual problem. It's actually a manifestation of a lot which is going on in the body, in the mind. So it's an overall barometer of the men's health. And if somebody is coming here for sexual problem, then we do need to look at all the other health aspects for the man. And basically, once we kind of attach to the man and give him a proper service, then we are creating a friendship for a lifetime, because the man will be less intimidated by the health services. He'll be finding it friendly and easily accessible. And then we will have him coming again and again to the sexual health clinic or to the men's health clinic or to any other holistic health clinic where, we want to kind of create or cater men to. Similarly, this goes beyond health. It doesn't just include, serving men for their health. It is a nation building exercise. It's important for the nation's economy that men are healthy and they are given the right services. So we have to continue providing services through the continuum of comorbidities. We have to understand that LUTS, erectile dysfunction, they are all a part of the bigger picture, which is hypertension, dyslipidemia, diabetes, endothelial dysfunction. So we all know that, physical inactivity, smoking, energy-dense foods, and stress, which are more common for men these days, they are going to cause adipose tissue hyperplasia, hypertrophy, and that's going to alter the inflammatory markers and lead to the metabolic syndrome. But what we seldom realize is this is a diagram which we've taken from the physician's perspective. And here we've talked about hypertension, diabetes, myopathies, insulin resistance, dyslipidemia, atherosclerosis, non-alcoholic fatty liver disease, but we have lost our understanding that LUTS and ED are the very common parts of metabolic syndrome. And most patients will not come to you for diabetes, hypertension, myopathy, insulin resistance. They will come to you very late for these reasons. But they will come to you very early when they have erectile dysfunction. So let's focus on this important aspect of metabolic syndrome and make men visit clinics and give them a good holistic approach so that they are able to visit the clinics again. So what we as an expert can do is we can all learn to evaluate men for sexual health issues, because in many of our OPDs, when men come, we don't even ask them about their erections. We are ourselves too shy to ask them about their sexual health. So we will be seeing a patient for diabetes for the last 15 years and managing his sugar, but we would not have asked him even for 15 seconds how his sexual health is. That's what happens in most of the practice patterns as per our research of the Men's Health Society of India. So we should all be equipped to be providing the basic men's health friendly facilities, basic management of erectile dysfunction, basic management of mental health, and at least screening for these conditions, and then referring to a person. So let's start with this case, a common gentleman that you have definitely met in your clinic, somebody who is obese, 62 years old, already sons are married, settled somewhere else, and they live in a small 2 BHK house where they are just a wife and husband alone, losing their intimacy. Occasionally the man masturbates, is hypertensive for 10 years, on medications off and on, cannot comment on how hard he's not even able to see his penis to evaluate it because he's got a big tummy. Now he visits the physician for depression or maybe, for hypertension and whatnot. But then we all should need to know that we do need to assess this person for his sexual history also and do a focused examination on his androgenization. We know that when the adipose tissue is going to increase, then it is going to eat up all his testosterone. And this man is going to be converted into a woman in certain ways by the distribution of fat. And we need to stop it. We need to get him his manhood back, which will automatically be, helping him with his lifestyle disorders like diabetes, hypertension, and whatnot. So we need to evaluate his labs like we already do, but we have to include more sensitivity towards testosterone, towards lipid profiles, and maybe do an oral sildenafil test if the man is complaining of erectile dysfunction. And basically we have to do a cardiovascular evaluation for these men who are coming with these problems. And it's very difficult to do a cardiovascular evaluation again in developing countries because we don't have enough cardiologists. So simple questions like, are you able to climb 2 flights of stairs without having dyspnea on exertion are good ways to assess the cardiovascular health. And once patients are here, then we need to re-emphasize, because ultimately the treatment for many of the men's health problems is lifestyle changes. It's as simple as that. But we need to make that men aware in our clinics that they have to start exercises, focus on weight reduction, quality of diet, smoking cessation, alcohol control, stress reduction, and all those things. And we can probably, give him a little phosphodiesterase 5 inhibitors to keep the man happy and let him keep visiting our clinic again. Because phosphodiesterase 5 inhibitor is not just helping us with the erectile dysfunction. We all know it has started for pulmonary arterial hypertension, which was a serious condition. So it helps everywhere. It helps with the flow of urine. It helps with improving the erectile dysfunction of the patient. It helps with both improving the basic physiology of the man. But I just wanted this opportunity to make everyone here aware of what typically we can do for patients with, who are presenting with problems related to men's health, where we have, taken a little amount of time and talked to him about his sexual health. Because just talking to the man about the sexual health and not being able to offer anything to the man is again a problem on our part. If we offer inadequate services to our male clients. So basically, we start first with understanding the cause of the erectile dysfunction, and then we can start with phosphodiesterase inhibitors and something like nitric oxide donors like L-arginine or even nerve tonics, and we can combine these therapies. If this doesn't respond well, then many physicians, I would expect them to be aware of intracavernosal injections, where we can help men sexually by at least injecting it on an SOS basis. And this is something that I would, be interested in for most men's health clinics to be able to offer, apart from lifestyle changes and managing the primary diseases. So just taking you through the continuum of what kind of a management. So it's not so easy that we will just give sildenafil or tadalafil to every man who comes for a men's health problem where so-called he's having a sexual problem. We have to see a lot of factors as to what is the age, what are the requirements of the patient, what are the comorbidities of the patient, and which drug, because there are so many drugs available. We have nutraceuticals, we've got sildenafil, tadalafil, vardenafil, udenafil, microdenafil, avanafil. We've got SERMs to increase the testosterone. We can even give testosterone or combination a lot. And then we have to think about what kind of requirement is there. Is it a chronic low dose requirement? Is there on-demand requirement? Does the patient need more than usual because he's having more morbid disease? And which kind of formulation? Should it be a mod dissolving pill? It should be a regular pill? Should it be a strip? So these kind of things we need to be aware of. And we can have certain sessions on, choosing the right drugs for sexual needs sometime later, because today we're just covering men's health. But we have to understand that again, when we are giving these medicines, the patient should not be on nitrates, at least. Any other thing for cardiovascular disorders is absolutely okay, but nitrates, they would lead to postural hypertension, which can be life-threatening. So this is one of the biggest no-nos when we are trying to give the patient phosphodiesterase inhibitors like tadalafil 5 milligram or sildenafil 50 milligram. And also patients who are already on alpha blockers, in those patients also, sometimes the hypertension can precipitate. So we have to be, again, very cautious when we're giving it along with, tamsulosin or alfuzosin or silodosin, for example. And especially in elderly patients where the metabolism is low, I would request all my colleagues to start with very low dose sildenafil, maybe 25 mg and, just 5 mg of tadalafil. And then if we find that this patient needs more than just the basic management and evaluation of ED, then we need to refer these patients to, we should have a back integration, which we will be talking about. So these are just the advanced things that we can offer for erectile dysfunction. So basically, when we talk about the back integration, we have to understand that every men's health specialist, which now you are all empowered to be, has to have a circle of colleagues whom they can refer to for different problems. Maybe if you're not a cardiologist, then you can refer to a cardiologist colleague. If you're not somebody who can deal with advanced erectile dysfunction, you can refer to an andrological colleague. If you are somebody who's not able to deal with the mental health issues of the patient on its own, and you see there are clear signs of depression and anxiety or stress, then you should have physicians whom you can refer to as a psychiatrist or a psychologist. So as a men's health expert, you are the center part. You are the one around which all the experts will revolve. And the man should be able to get holistic care when he comes to you. So if he's coming to you with diabetes, next time do ask him what is his stress levels like, what is his erection like, and then do refer him to, or maybe how is his performance in terms of climbing the stairs, and do refer him to a cardiologist, an andrologist, and a psychologist to help him deal with the stresses and everything. And it's not just for the younger patient that men's health is important. It's because sexuality and aging are both very integrated, and we know that 72% of the individuals below 60 are sexually active, but 60% of individuals above 60 are also sexually active. So it's more than the average. So we cannot take it for granted that if somebody is above 60, they are not sexually active and sexuality is not important for them. Because we understand that for men, sexuality is a thing for which, they typically go to a men's health center. So our centers need to be equipped to handle men's health, and they should be at least be offering screening for men's health, if not treatments, or if not the holistic care right away. So it's easy to start with new checkpoints for men. For example, a premarital checkup, which can, which if mandatory, then we can have men coming to the clinic and interacting. Executive health checkups for the various corporates and companies, and for people who are these men, we can have annual checkups in terms of the executive health checkups, and we can have more checkpoints in our, in our armamentarium. So the guidelines on men's health of Society of India, which are Indian guidelines on men's health, we had, summarized the common screening modalities that we offer. So in between the age of 18 to 30, we focus on disorders and mental stress and contraception and testicular tumors and all these things. And then basically we offer them a 2-year screening and a blood screening every 5 years, which is very, very doable, and very small panel of tests based on evaluation and symptoms. So this is, I would not want to go too much into details. I think we can all take pictures or screenshots of what kind of tests we recommend as the society. But we need to have such posters where, in the clinic, when men come, they're able to, talk about all the things. So we have to encourage men to speak up about their sexual problems, about their stresses, about their peer pressures. So somehow we will, in our clinics, in our establishments, we'll have to make them more men's health friendly establishments, so to say, wherein we make them aware, and actively we ask them to, talk about their problems and give them a very good environment to talk about problems. We can offer wellness checkups, sexual health consultations, lifestyle disease managements, executive health checkups, premarital counselings, mental health consultations in our clinics. And basically we were talking about, the involvement of women in this. So we know that educational intervention and involving women in or partners into the healthcare of men is a very huge step to take this further, because men themselves don't come forward. They have poorer knowledge. They find the screening is a waste of time for them, and they usually find the screening facilities cumbersome. So basically, women, if they push their men, then we will have men coming further. So involving partner, developing more male-sensitive interventions, having a fun way of screening, gamifying and glorifying screening are the ways in which we can increase screening. And we have to enforce our screening, because men don't listen like that. We have to make it a part of the policies. If there's a company, then they should force men to actually go for the screening. And camps are a good way where we can probably increase the men force coming to us. And so basically what I request all the audience here is to start, more their clinics in a more friendly way for men, wherein they need to understand men's health like we've done today, and then maybe even go through a few guidelines and equip further in the basic management of problems that men find are very important for them, and then reform the facility a bit by doing more outpatient sensitization about men's health, and providing more screening opportunities for men in terms of premarital health checkups, or maybe so this is going to increase our clientele and even financially make us perform better in our clinics, and then associate with men's health as a social cause, not just as an establishment or as something that we need to do. So basically at entry, you should have the checkups where, before marriage and retirement and geriatric and parenthood, there could be checkups, and make health an important performance indicator for the men. So typically, this is a format of how a men's health clinic can look like. If somebody wants to create a particular men's health center, where in a financial profit comes with just 50 to 60 patients a month, which is not too much, just 2 patients a day. And the best way to start a men's health practice is to just give a particular time in the day for the men's health. Maybe evening part is when you can just catch up with men as friends and help them as a social cause. So it's easy to start small. You just need some basic diagnostic tools. And we should all, in fact, take up men's health as a social responsibilities, because as doctors, it's our responsibility to be serving our communities, to make this gender ratio, which is now 10:1 in the octogenarian age, to again 1:1, where men are surviving and living enriching lives with their partners, even as they progress into being elderly. So we need to have more central programs. So each and every one of you can be an ambassador and affect the policy making of your nation. Where again, apart from maternal and child health, even men's health is given a program, and because we have to make our governments realize that men having poor health is economic slowdown, and loss of men is a loss of economy eventually. And that's how we can probably we'll be able to motivate. So I think I'm already shooting ahead of my time. So I'll just conclude with a couple of slides that we need to change the way we look at men's health. We need to see men differently. We can't see them as physically more strong or capable or reliant. We have to see them as a weaker sex. We have to tell them, we have to understand their visit to a clinic is very precious. They're not going to come again and again. It's going to be very difficult for them to open up. We have to see their problems in a different way of light. So their problem, whatever they're presenting with, is just a part of the bigger metabolic syndrome that is going on. And we need to give holistic treatment and referral for those patients. And we should be providing them with men's health friendly facilities where there are screening opportunities, where there are posters to talk about things, there are videos to talk about, and make men's health talks a normal talk in the society, just like women talk about their periods. So as a social responsibility, as a responsibility of being a doctor, and not just that, even as a medical opportunist, men's health is an opportunity which is waiting to be taken, because there is still so much to do in the men's health space. Especially in India, because we have our statistics, we know it's a huge opportunity and it can be a huge financial success. So how do we start practicing men's health? Is by changing the approach to a more holistic approach, to making it an integrated medicine, to have a team of experts around you, even if they're not in the same clinic. At least you can refer to them so that, if somebody needs help, if they're not able to say it outrightly, they can in private visit the cardiologist or the psychologist or the psychiatrist or the andrologist. And then basically we have to practice on evidence-based medicine. So we need to keep upgrading ourselves on men's health and the protocols and the guidelines. And we have to form an image which is approachable for men, where they can talk to us in a very friendly way, and also be affordable. So we can contribute by supporting our local fathers, giving a little budget or a little time to men's health practice, maybe having screening camps around men, corporate programs, celebrating the special days of men like the Men's Day or the November, where we talk about prostate health awareness, and include the checkpoints for interaction with health. So this is just a few things about the Men's Health Society of India, where we've made guidelines, where they were released earlier by the president of the AUA, Dr. Raju Thomas, and then by the president and secretary of the Society International Urological. So we've been doing our work, but a lot has to be done in terms of awareness and offering the service centers and collecting data and encouraging research and talking more about men's health, because men's health is a specialty which is waiting to be claimed, and there's so much to talk about on this. With that, I would again thank you all for being there in the morning, busy on Saturday, on your weekend, and sparing time for a noble cause for men. Thank you so much.
Thank you. And well concluding session. And I thank you for bringing up this topic. It's a very important topic. I would open the forum for the question answers from the people mentioned over here. Rightly said, this is a topic where people don't come up front and start talking. So I think we would have a lot of questions in mind. So please come forward and ask questions. And if anyone wants to come and ask questions, I did repeat it before that you can come and join the Zoom session. The Zoom session is 818-8591-1572. And I'm very sorry for what happened initially. Yeah, overhead.
Raman, I think it's a beautiful, maybe excellent lecture. It's eye-opening. And I am a surgeon practicing urology, because I am of Western generation, where we practice urology without MCH degree. And I think we need to be surgeons, urologists, and everybody need to be aware of this whole fundamental phenomenon. While you showed the slide, I just click into the QR code and went to that your Men's Health Society of India site. But then do you have how to become member and how to get those guidelines?
So, sir, of course, I'll take the details from Saurabh, and we'll give you a personalized mail and how we can help you to, help us with this cause. Because if you join in, then of course it's a benefit for us eventually, for the society.
Yeah.
There was a question where it was in the earlier session where we got this interrupted. A lot of people don't even like it. It's so common problem, and it is so much like a lot of people have taken advantage, because when you have when you have an issue of speaking with people, so other people take advantage out of it. So the question was, if I read it properly, that who is the first person of contact if the issue comes up? Is that your MBBS doctor, your family doctor, urologist, or sexologist? Because I think there is another definition of what's the difference between a urologist and a sexologist.
Right. So
So if you
basically, again, what the Men's Health Society of India is working on, and what the other programs on men's health in even the US, for example, if Dr. Monica would be aware of them, is that, men's health can be practiced by anybody. And that's the beauty of it. It's just that you need to be inclined to practice men's health. You need to be sensitive towards the need of men. That's all it takes. It doesn't take a degree, actually. It's just that you should be a recognized medical practitioner. And since we usually talk of metabolic syndrome as a Western system of medicine. So I would encourage my colleagues who are practicing the Western system of medicine to start, just being more inclined towards this branch, and that will be enough for them to start working in the domain of men's health. So we would be happy if we ask the question to men on who is the expert to go to, and then men would answer that just like women go to a gynecologist, the man can go to a men's health expert, and that's all that will be a success for the society if men can have doctors whom they can relate to as men's health experts and go to them for the rightful guidance. And this men's health expert is not a sexologist or a urologist or an andrologist. He is somebody who understands the entire system of medicine of metabolic syndrome, and just takes the advantage of a man presenting for a sexual health problem to evaluate and treat the man holistically and give him such an environment where the man is able to open up and come again and again to visit the healthcare, because that is the only way in which we can prevent disease and then restore the longevity of men, which they have kind of lost over the years because of being following the Herculean image, so to say. So that's all.
Shall I add something?
Yeah, please, sir.
I had the opportunity to conduct first clinical trial of Viagra in India long time back, before they entered into the market. And we conducted this trial in Sassoon Hospital. And then we put a small advertisement for recruitment of patient. Believe me, we were just flooded with requests. We wanted 60 patients, and there were more than 2,000 queries. And then all of them, they have all sorts of problems. And I think you rightly said, the problem is very, very wide. And everybody listening to this talk was assuming as if he's looking at the mirror. Because everything, what we see, we never expose and we never think that is required. And all those Father's Day and whole day and one day, every world remembers father, and rest of the time, they just don't worry about Y chromosome. So I think this is something which is far more interesting and I think far more reaching. So thank you for sensitizing all of us.
Can I add something?
Yes,
Bukhari.
Thank you very much. I am Professor Bukhari from Pakistan. Really, it was an eye-opening presentation. Thank you, Saurabh. You selected this topic, especially neglected health on the men. As a pathologist, I saw that where the men are lazy, are reluctant in going to the doctors, they are also reluctant in coming to the labs for their investigations. As we know, in India and Pakistan, इंसान अपना डॉक्टर खुद होता है. We are our own doctors. When we feel something, I think it is the duty of the men are to go the first family physician, and then after that to go the specialty and the super specialty. As in the gynecologist, there is a specialty gynae and obs. I think there must be a specialty in men as the geriatric medicine. I think awareness should be created for males, because no doubt the responsibility is India and Pakistani men's. They bear more as compared to our cultural issues, social issues. So for the good health, I think such type of the webinars, such types of the camp, subtypes of the social media and articles should be written about it to create the awareness, the men's. If you are healthy, your home is healthy. Thank you so much once again.
So Dr. Mulazim sir, again, brought up this social media as one of the ways. So, of course, what I have in my personal capacity been doing is that I have launched a magazine for men, which is talking about men's health and lifestyle. So another problem that we saw was men don't take up health as seriously. It's like an unpalatable pill. It's always going to be bitter. So you have to sugarcoat it with lifestyle and glamour. So we started this magazine called Best for Him. And also, we are into an initiative where we can have more social media presence. Now we're almost reaching out to about 2.5 lakh men, which is not a very small number, but it's not a very big number because we have to reach out in billions and we are just in thousands, unfortunately. So again, it's a call for you all to contribute to this cause. It's a magazine, you can write articles there, and we can do a lot together. We need our health care practitioners also to think about this cause and give some time to this as a social initiative.
Can I invite Dr. Monica Vasudev for her comments?
Yeah.
Dr. Tanwar, that was a fantastic talk, and it's all about gender equity, but it's also about equity in a lot of issues. You were very eloquent in starting off your conversation about how men approach healthcare differently than women from a societal perspective, but also from their own personal male-focused health and reproductive health. I think it is very different. Men have expected different touch points with healthcare. I think the opportunity to really make an intervention is through our health medical education. So whether it be, how do we recognize that men, when they come for help or advice, that they may not necessarily reveal all their issues. They're coming in, but they might just scratch the surface. And where is it that we can capture all the issues, the medical issues that we need to see? So for example, with anything that's vascular disease, for example, you can have ED when somebody's coming in for dyspnea on exertion. So those are issues where whether you're going to cardiology or whether or not you're going to endocrinology and diabetes health, that those are opportunities. When they don't want to express their symptoms, can reveal their symptoms in a more quiet way through review of systems surveys. So as part of our healthcare approach here, we do what's known as a review of systems, where we go from top to bottom in every system, and we ask everything. We ask women's health and men's health, and you don't have to ask it in person where they have to reveal it. They'll check off a box, and you look at the sheet and then say, okay, we have some questions. Is this something that we can explore? But that's something that should be teased out with our medical students, that should be teased out with our post-medical education students, saying, we have a man here who's likely not seeking healthcare, has a chart that's really, really skinny, but likely has the 50 medical conditions that we can list. And so that's where I think your topic, your efforts, your audience is so extremely important. And I really appreciate however you brought everything today. Thank you very much.
So thank you, Dr. Monica, for those expert comments. As a society, the Men's Health Society of India, and we, of course, we're affiliated with the International Society of Men's Health, which is, which is led as an international body. The challenges are that, even if it's taken us about 12 years, we started in 2010, and now it's been about 12, 13 years. Somehow it's a topic which we're finding very difficult to percolate into the medical education system. And that's why, the more awareness we have, I'm sure that amongst you are thought leaders and key opinion leaders. And, once you're aware of this, and each of us can influence in our own local way and make it, a bigger effort for it to be actually realized.
Raman, taking it forward. I think I was Vice Chancellor of a medical university called MUHS. At present, I am a distinct professor with symbiosis, where I hold a advisory position. So maybe let us take a first step, and we start a fellowship program in men's health in Symbiosis International University, a medical college. And I'll request you to become, say, maybe guide or something, or then we can appoint you as some professional position. But what is required is to creating a curriculum of 1 year, and comprising of all aspects. I think it would be integrative, but I think we need to take a first step. So let us take, I'll talk with Dr. Rajiv Yarwadekar. I think this is more interesting, that we can have 1 year program fellowship program in medical college. Thank you.
Can I, Raman, can I intervene?
Of course, sir.
Thank you very much. It was very nicely. You have covered everything. And as you know that I'm associated with you, and for last more than 4 decades, I'm practicing as a family physician. But unfortunately, I confess also, the system of family practice has gone in our country. That is the biggest drawback. I always used to say, family physician is the first person in contact with the patient, and he is the backbone of the medical profession. Now the things are changing a lot. And as far as the male health is concerned, you are rightly said that males are very reluctant to give detail about their health. That is the biggest problem. So that is the biggest problem. So only the thing has come, and particularly in the city, lot of sex clinics are flourishing like anything. And the myth is there. People are going there. They are not educated. That is not a evidence-based medicine also there. But they are just going because they don't want to go to the qualified person. That is also the drawback. When I started practice in Delhi in 1980s, I used to see 2-3 patients every day. They were coming to me for such type of the problem. But after now, I can say hardly anybody comes after once in a blue month or once in a month only. So some changes has definitely come up. So as you are doing a lot in this way, I think the best way will be to promoting the men's health and the colleges also, and in the seminars also. If we can again make a group of family physicians who are more interested in giving this treatment, that will be very, very nice. And once again, kudos to you for covering everything. Thank you very much.
Thank you, sir. Again, just as a small response to what Dr. Arun had talked about and Dr. Rai had talked about. So Dr. Rai is well aware that in 2017, we integrated with Indian Medical Association and for making a curriculum, and that curriculum is already in place.
So already there. It's already there.
But the only thing is that adoption, finding the right people who are inclined to this subject and who are ready to take it forward, give it time, give it their blood and sweat. That's where somehow we've not been able to make a breakthrough, unfortunately, because it's not that this subject would be enticing for everyone. That's a thing. So in this huge population, how to find out those people who are there, who will be the torch bearers of this further, is a challenge. And that's why it is always my keen endeavor to be talking about it wherever possible, because I might find one more flame here or there and make the torch brighter.
Anyone else has any questions or comments before we do the closure of the session?
Saurabh, can I say something? Dr. Nizami?
Absolutely,
Thank
Dr.
you.
Nizami.
Thank you. Raman, thank you very much for a wonderful talk indeed. I think it is a dilemma in the countries like subcontinent, particularly India, Pakistan, Bangladesh, or so on. And people are hesitant. And what are our social norms and what people can speak about, and that is the dilemma. And I appreciate what you have started about it as a men's health. It is very important. It was very catching for me, rather than speaking about the sexual issue or sexual problem for men. It is something which hesitates a man. So talking about a men's health, I think it is very excellent. And indeed, we have to do so. And my colleague from Delhi, as he was saying, that people are not coming to the doctors, and there are, the quacks who are flourishing everywhere in our countries. And that has to be stopped. And we, like the medical association, we have to speak about it, that the people who doesn't understand about the depth or the issue, they are giving their, these pudiya vudiya and so on, and the medications. So again, thank you very much, Saurabh, you too, for this very wonderful arrangements and so on. Thank you very much.
Even Dr. Nizami, they are as a pathologist, I have seen, they are very much reluctant to go for the investigation in the labs. So this is again a dilemma, not only here, everywhere. The men feel that these money will be spent on our other issues. So these webinars, these are very important to create the awareness about the health of the men Not only the sexual, there are so many other health. Thank you so much, sir.
But I didn't say about the financial or so on, Dr. Bukhari. It is about our social dilemma, what I was talking
Yes, social
about.
dilemma.
Right.
Yes,
Yeah.
right.
Thank you.
Right.
Thank you.
Yes, right.
Thank you. Thank you.
So, Professor, sir, just to thank you for your feedback on this and your comments on this. The thing is that that's why we came up with men's health as the name, not sex clinic or sexual health clinic, because we do understand that, especially in Southeast Asia and this part of Asia, we have social problems because of which men may fail to come, and then again. Just by luck, by chance, you can say that we do find that the sexual problems are actually just a barometer of the main problems which are going inside the man from head to toe, for that matter, from the mental health to the to down there. So it's more appropriate for them to be called men's health centers and clinics that will encourage men to be coming there without any taboos, without any fear of being judged around their manhood, which is, so to say, a very big problem for men, to talk about their manhood and to talk about problems that they're having in their manhood. So of course it's a right approach, but we also would have to offer it holistically. We would not be just offering sexual health also. The strategy is to be listing all the services on men's health in terms of mental health, in terms of lifestyle disorders, in terms of sexual health, all that. So that's why, I said that anybody who is practicing the modern system of medicine, who understands internal medicine and the general holistic medicine, is appropriate to, take steps in this direction.
Right.
Question and a comment in the chat box. I will read it for you. The comment is, the problem is that other men and even women makes fun of the men who have a problem, and they made fun of the men that perceives to be weak and abuse and make fun of too much misconception, judgment, even by misguided professionals. Sexual health and hygiene has to start from an early age, and misconception of taboos broken. So this was a comment. And we have a question. Sex is binding force in a marriage or a relationship. Marital problems arises when a woman in perimenopause and not interested in sex, while men is sexually active and the basic needs is not met. This leads to frustration, substance abuse, extramarital affair, mental health issues. How can this be addressed?
Right. So basically, as I said, that it's a hub and spoke model in which we have to practice men's health. So if I am the men's health expert, then I would have experts around me whom I can refer these men to, because of course I cannot be an expert for each and every detail of the subject. So for example, we talked about fun being made about men. So similar thing help with mental health and therapy also. So if somebody is having depression or stress, it has been long that society has been facing these issues that you don't want to go to a doctor of the mind because you'll be labeled a lunatic or so they have overcome this problem by awareness, by giving more people the exposure of being in a space where they're listened to without any judgment or without making any remarks. And that's exactly what we need to do for men's health also. We need to provide a judgment-free atmosphere where these problems are properly understood, and we are giving radical solutions to these men which are effective, so that these men can then be ambassadors of men's health further and get their friends and colleagues and everyone else who is suffering from the problem. And then talking about the perimenopausal issues, I think that's more of a issue around the female medicine, as well as probably the psychologists, where they as a couple have to sit and understand the needs of each other as as man and wife, and then deal with it. So again, that's a part where if they come to a men's health expert, he would refer them to a marital relationship coach or a psychologist, and get their spark back.
Absolutely.
But then the man should not be allowed to resort to substance abuse or going out and practicing unsafe sex to just cover up the issue, because that's not the right approach.
So in the interest of time, I will just take the last question. Role of diet and food in men's health, and do you recommend any? And this is the last question. And with this question, I would also like you to conclude the session with your take-home message for our audience, and early symptoms which people should notice in their body and how to approach.
Right.
Please go ahead.
So that's again a very pertinent question on lifestyle changes. And we all know that, even whatever problems that men have, they are related to the mind and the body. And there are certain general principles that each of us, is equipped to tell men, even if they are practicing men's health or not practicing men's health, which is to exercise at least 150 minutes in a week, and to have a balanced diet, which is as physiologically good as possible. And I don't really need to deliver on smaller points. But the unfortunately the way to deal with all problems is very simple, and basically it's a common format for whether there's somebody who's having a lifestyle disorder or a sexual disorder or any other men's health problem for that matter. But again, because we are running short of time, I would just want to conclude by saying that this effort that the Men's Society has been doing, the best that best for him has been doing, and that all of us are doing somewhere, because you're being in this talk, giving your time is again an effort that you made. So I'm thankful for that from the bottom of my heart. And I would just want to say that, if possible, let us all give some time to men also in this of the society, and start practicing men's health in whatever way we can. If we need certain resources, if we need to understand how to navigate through it, you can just get in touch with me. I'll be more than happy to help. And for the general audience here who would be interested in understanding how men's health can be tackled better, I think the first take-home message is that don't think of a sexual problem as just a sexual problem. It's more than a sexual problem, because there is a lot going on in the body which has led to this problem. And that's why we would not just call this a sex discussion today or a sex talk today. We'll call it a men's health talk today, because we are again talking about this entire aspect very organically and very holistically. And we all who have been a part of this talk as experts would be more than happy to help such people who are suffering from problems which they feel are just social taboos, because they are not. We have to think, we have to grow and broaden our vision to thinking of all these problems as more than just something which is kept a taboo or a secret. We have to talk about it in a more open way in the society, and then also treat it in a more holistic way. I'm sure we'll have more people joining in this campaign, and we'll have our men being served better, and for making a greater change in the society.
Well, I thank you for taking this excellent topic and an excellent session. And I would want you to be conduct a follow-up session after some time. I really thank you for coming over and helping us out. With this note, I would like to end this session. I thank you everyone for joining in. We will see you again next week. Thank you.